With COVID-19 daily cases still exceeding 5,000, the demand for vaccination continues to surge. Malaysia Kini previously reported that some appointment slots were quietly being sold to those who wished to jump the queue for the jab. With all the vaccines being controlled by the government, where could the loopholes be? A KiniTV reporter recently contacted one of these alleged appointment agents through WeChat to get a better understanding of how they work. The agent, who spoke with a mainland Chinese-sounding accent, claimed that she had a contact who could allocate vaccination slots at a vaccination center or PPV in Kepong, Kuala Lumpur through the MySejahtera system for anybody willing to pay.
钱是你先汇的，你先给钱，然后切你的那个 MySejahtera 里面的注册资料发过来，然后这边安排时间就会通知你，然后到那一天的时候，你那个系统才会出来资料，然后你才出发去打。如果你给了钱没有打到，肯定保证会退钱给你的，因为你也是朋友介绍嘛，肯定也是有信任，我也不可能为了那个钱然后就吃了吧，这个反正也没有强求，如果你相信你就打，不相信就不要打。
KiniTV did not make any payment and cannot independently verify this person's claims. However, she mentioned that she is active in several WeChat groups and attempted to use this as a gauge for her trustworthiness. Meanwhile, another informant told KiniTV that at least two of her acquaintances had approached her to sell her appointment slots that they managed to secure. One was selling at 300 ringgit, another one at 380 ringgit.
He said he can slot 1 or 2 in. But we have to pay. We pay about 380.
All these cases point towards possible loopholes in our MySejahtera vaccination appointment system. Dr. Goh from Perak owns a private clinic that is also a government-appointed vaccination center. He confirmed that private medical entities are appointed to be vaccination centers by the Ministry of Health and are given access to the MyVac system, which administers COVID-19 vaccination appointments. According to him, all vaccination recipient lists are pre-arranged by the authority in the MyVac system, and vaccination centers can only collect the exact amount of vaccines from vaccine storage centers based on the list. However, in the event that any recipients are absent, vaccination centers have the discretion to create new MySejahtera appointments for somebody who is yet to get their vaccination in order to fill the slots. Dr. Goh believes that it is extremely difficult to keep an eye on how these vaccination centers decide who to add to the wait list and if anybody is profiteering from it.
Up to us actually. One day got how many thousand being vaccinated? I don't think so anybody can go and see, oh, what is your IC number? Oh my god, hey, why are you 18 years old now? Nobody know. If you push one group 50 fella inside, then sure people will cash lah. You push 2-3 fella one center, 2-3 fella one center one day, nobody can question you.
Our journalists also spoke to two volunteers who had worked at a vaccination center administered by an appointed private specialist clinic in Petaling Jaya. These volunteers claimed that the staff at the center, who were all employed by the private clinic, reserved backup appointment slots for their own clients. Some of these guests even showed up with letters of invitation from the clinic. These guests were subsequently jabbed and given MySejahtera appointments on the spot.
When the second day when it comes, there is more and more of them coming in and say that they received a call from they received a call from. However, they rejected many of 60, 70, even 80 years old folks who came forward. Many of them, they waited for long, almost 2 hours the first days, okay? They never get the jab. And some of them waited 45 minutes. On the second day, also didn't get the jab.
These volunteers also witnessed members of the public, among them some senior citizens who walked in and registered to be on the wait list. However, those who actually ended up arriving for the appointment slots were mainly clients of the clinic and people who appeared to be below the age of 40. They also showed up to get their slots before 4 p.m. When KiniTV contacted the clinic, we received an explanation that the waitlist for vaccination included but was not limited to patients, business partners, staff, residents near the clinic, school teachers and members of the public. It was handled on a first-come, first-served basis. It was a matter of chance as to who gets vaccinated first. The email says on some days there was an excessive amount of people on the waitlist and they regret that they could not accommodate everyone. Still, the clinic did not reveal how many slots on the waiting list were available for for the public to register for, especially for the elderly, and also what kind of prevention and control measures they had taken to avoid young recipients being prioritized over walk-in senior citizens. This was what Khairi Jamaluddin, the minister in charge of the national COVID-19 immunization program, said when asked by KiniTV on the possible loopholes in the MyVas and MySejahtera systems.
Initially, the backup list was only managed by CITF. However, the backup list system has evolved, where in some states, the Jabatan Kesihatan Negeri supplies the backup list, while in other PPVs, the healthcare organizers or organization will be using theirs. But this has to be approved by the penyelaras at the PPV, usually a representative from Kementerian Kesihatan. We are aware of some of the loopholes in the backup list mechanism, and we are working on plugging these loopholes as quickly as possible.
At the time of recording, there are still around 600,000 senior citizens in Malaysia who are awaiting their first vaccine dose. It becomes even more important now to prevent bad actors from abusing the system and disrupting the deliveries of vaccines to those who need it the most. Therefore, as a Malaysian, if you come across anyone selling a vaccine appointment, do not give them your money nor your attention, and instead report them to the authorities. Together, we can create a better system that's both fair and just. Mandy Long, Robin Kaur reporting for KiniTV.